For years, formal physical therapy has been the standard recommendation after total joint arthroplasty, or TJA. Many patients expect to attend structured sessions as part of their recovery, but recent research is challenging this long-held belief. Studies now suggest that formal physical therapy may not always be necessary for everyone recovering from joint replacement surgery. In fact, some evidence points to increased risks of complications and higher costs when formal PT is used routinely. With the rise of value-based healthcare and the significant expense, averaging $2,500 per course, it's time to reconsider whether every patient truly benefits from formal PT after TJA. Let's explore what the latest science says about recovery options. When it comes to total hip arthroplasty, or THA, recovery is often less painful and demanding than after a knee replacement. Recent randomized controlled trials have shown that formal physical therapy is not required for most hip replacement patients. In these studies, patients who followed unsupervised home exercise routines achieved similar functional outcomes as those who attended formal PT sessions. This means that for many, a self-directed approach at home can be just as effective. However, the situation is a bit more complex for total knee arthroplasty, or TKA. Some patients do benefit from formal PT, especially if they have trouble regaining knee flexibility or function in the first weeks after surgery. So is formal physical therapy necessary for everyone after joint replacement? The answer is not always. For many patients, especially those recovering from hip replacement, unsupervised home exercises can be just as effective as formal PT. For knee replacement, a patient-directed approach works for most, but some may need extra help if they struggle with mobility early on. Ultimately, the decision should be personalized, taking into account each patient's preoperative physical function and their progress after surgery. Surgeons and patients should work together to determine the best rehabilitation plan, balancing effectiveness, safety, and cost. This patient-centered approach ensures optimal recovery without unnecessary interventions.